How long does it take to get a blepharoplasty surgery done? So, blepharoplasty is done for eyelid creases, eyelid bags, upper and lower. Both the eyelids can be addressed by a blepharoplasty surgery. And in this video, I will be discussing about how much time is required if you are planning to go for a blepharoplasty surgery. Hi, I am Dr. Hiranmayi Jha. I am an aesthetic plastic surgeon and I work at Eterna Vision and Aesthetics located at Shivalik, Malviya Nagar. It is an eye care and a plastic surgery center. And we deal with blepharoplasty surgeries. So, blepharoplasty is done for upper eyelids where there is a sagging of the upper eyelid skin, or it's done for lower eyelid bags. If you are planning for a blepharoplasty surgery, you have to take a few points in mind, that a few blood tests need to be done before you are going for surgery. Complete eye examination is important. Eye examination for other disorders like dry eye syndrome or Schirmer's test, and a few tests are to be done before you go for the surgery. The surgery is done under both topical, local as well as general anesthesia depending upon the patient and the surgeon's choice. Now, for going for upper eyelid blepharoplasty, what we do at EVA is we prefer topical anesthesia, in which topical plus local anesthesia is preferred, in which you are completely awake during the surgery. A few injections are given around the eyes and a few drops are given so that you are completely numb and you do not feel any pain during the surgery. The total duration of the surgery is 45 minutes roughly. The eye fat pads which are present in the upper eyelid are addressed and the crease is created along your fine creases which are already there, and you can go home just after a waiting period of half an hour to 40 minutes post surgery. So, basically you need to take 2 days rest maximum from your offices. There might be some swelling which are present in your eyes and some cold fomentation, a few eye drops as well as a course of antibiotic for 5 to 7 days are the maximum requirement of follow-up cares that you have to take post surgery. When you are going for post surgery, you have to take care that you are not supposed to drive just after the surgery because there might be some swelling there. Some amount of bruising is also there. If you have an event to attend, there should be at least a gap of 15 days or 20 days before you choose this surgery. The creases, the scars which come after upper eyelid surgery is hardly visible, it is imperceptible, it gets camouflaged in the crease line which is present over your upper eyelid. For lower eyelids, in most of the cases we prefer a transconjunctival approach, in which the eyelid bag is addressed or approached from under the eyes and there is no scar visible from outside. The healing period can be affected by a few comorbidities which are present, such as hypothyroidism or diabetes. These can go and affect the healing time of your eyelid surgery. Apart from that, if you are a healthy individual with no comorbidities, the healing is quite fast. The surgery time is also fast. You can get recovery gets as fast as within a period of 7 days. So, this is all that you should know about a blepharoplasty surgery recovery and the time which it is required if you are planning to go for one. Thank you.